Hello, I'm Trevon Jelinek, and I will be presenting usefulness of orthopedic shoulder surgery trials. Are they meeting key criteria? So we took a pre-developed assessment tool that looks at the usefulness and kind of lays out criteria for what potentially makes a clinical trial useful or not, quote unquote. Um, and it's not a very well-known criteria or tool, but we wanted to test it out and see how it would do in judging that against shoulder surgery trials. So orthopedic shoulder surgeries account for a good percentage of the overall orthopedic interventions. And so, as with many other subsets of orthopedics, surgery, and medicine in general, randomized control trials are really important for applying um, new surgical techniques, confirming surgical techniques, and also informing guidelines. And so the quality of those randomized control trials have to be very, very high um, to be able to reliably apply that to clinical practice. Um, and so we applied this set of criteria, which you can see in the top left table. Um, there's 13 items. The original authors did not do this, but we decided to break them up into kind of two subsets. The core usefulness, those first seven there, and then the transparency items. We use the same numbering that they did. We just kind of broke up the criteria a little bit differently to kind of provide more clarity and a chance for a more interesting analysis um, for these trials. And so, what we got as a result, um, well, let me say this first. The way we did is we took these 13 criteria, we assigned a score for each of the trials based off of these 13 criteria. Each criteria had a score from 0 to 2. Two being they fully met the criteria, one partially, and then zero, not at all. And so that came out to a max score of 26. And so the results are down there in the bottom left. Some of the criteria performed much better in our sample, and others did not. Problem base, which is basically how important the subject that the randomized control trial is trying to tackle, performed very well because they're all surgical trials and they're all really important um, issues and injuries. Um, and so what we got was a score out of 26 for each of these um, for each of these trials. And so we, like I said before, we broke it up. And as you can see, we did a trend over time up there in the top right hand corner. And as you can see, the when we added up all the usefulness score subset, and then the transparency subset, and then the right hand panel is the the two subsets together, or the whole criteria um, added together. And so, as you can see, the Usefulness had a slight decreasing trend, and then the transparency had a more positively upward trend, which which offset um, the decreasing there, the downward trend in the usefulness criteria alone, and to make a slightly upward trend in the whole usefulness criteria together over time. And so what we really took out of this is that transparency really drove these results, and the push in the medical community and the research community for more transparent uh, articles, reports, and clinical trials really allowed for this. And so uh, we decided that there needs to be more of that. There's still way more room to increase that, and thus increasing the reliability of these results that happen within these randomized control trials, so that there's no doubt when we go to apply these findings to clinical care. And so the real quick, the bottom right hand corner is where we decided to put the two subsets against each other and to see the correlation. And we see there's a positive and statistically significant positive correlation between these two subsets. If the trial is more likely to adhere to transparency criteria, then they're more likely to adhere to the other criteria as well. And so that's what we kind of expected to see, and it was good to see that as well. So that just shows that more push in this can overall increase the usefulness of these trials.